sharp scratch for me.
The fight back against COVID is fast gathering pace, here in Somerset and across the UK. Vaccination centres are rapidly being set up across the county in hospital hubs, local GP-led centres and large vaccination sites, while mobile vaccinators will help reach the very vulnerable. And not everyone involved in this battle is on the front line. Staff from Somerset County Council, the 4 district councils, community groups and volunteers are all playing their part.
Hello there, sir. Have you got an appointment?
Susie Gittings is normally a car parks manager with Mendip District Council. Now she's helping guide people to this vaccination centre. She's one of literally hundreds of staff from councils across Somerset who've been redeployed in the fight against COVID.
Really great. It's great to be involved with it and doing something that I feel is worthwhile and get real buzz out of helping everybody.
Dave Partlow and Gary Fracknell, 2 staff with Somerset County Council, are now also giving their working hours to the fight against the virus.
It's about getting the vaccine to the most vulnerable in society and getting it to them as quickly as possible. So that includes the 220 care homes that we have in Somerset, getting that vaccine out to those vulnerable residents that live in those care homes and the staff that care for them on a daily basis.
I've been asked to support the NHS with logistics to support the clinical side. We've now set up an increasing number of clinical care hubs around the county. You should be incredibly proud of your NHS and Somerset County Council staff who've approached this with incredible professionalism and indeed a smile.
As the virus continues to spread, people in the priority categories are, understandably, keen to know when it will be their turn for the vaccine. And over time, that's led to quite a lot of people ringing hospitals, doctors' surgeries, medical centres, sometimes turning up at vaccination centres without an appointment and being turned away. Now, if you are in one of those priority groups and you haven't heard yet, I know it's frustrating, but you can help the NHS by not calling them, because sometimes those calls are clogging up their systems and preventing people with real issues getting through. And as you know, the NHS has never been so busy.
We are following strict guidance from the government about who we can offer vaccines and when, and we're going through people in turn. So I wish that I could offer everybody a vaccine today, but we do need to go through a process of offering it to the right people in turn. So we will contact you.
The top 2 priority groups are residents in care homes for older people and their carers, anyone aged 80 and over, and frontline health and social care workers. But if you are in one of those priority groups and you haven't heard yet, the message is, please be patient, we are getting there. And if you do get the call, please come in. In the meantime, it is becoming increasingly obvious as the virus spreads rapidly that we really need to follow the rules. You've heard it said that if we break them, even flex them, we risk not only our own lives, but the lives of others, maybe our loved ones. I'll see you next week.